Good morning. Greetings to all of you, ladies and gentlemen. Many thanks for joining this webinar about effective access to supported technologies. I would like to, well, let's just wait for one more minute so other participants can join the room. There are 64 persons. I am Alexander de Gruper. I am the active interim of the unit for access to sanitary technologies in PAHO. That is a unit that is part of the Innovation and Access Department to Sanitary Technologies from PAHO. And today, I would like to start by thanking this wonderful team that is always working with different topics related to supporting technology, especially my colleague, engineer Jasmine Garcia, our consultant in supporting technologies, who is leading, technically speaking, this topic across the Americas from PAHO, and also a leader in this and I would like to thank our other colleagues that are here taking care of everything that's got to do with our webinar. So many thanks for the participation. I would also like to thank Kyla Shea from WHO. Kylie, it's a group leader of access to supporting technologies, access to medications and sanitary technologies from WHO, based in Geneva. So many thanks, Kylie. She As perhaps you know, we have a close cooperation between our team and PAHO Americas and WHO headquarters, who is responsible for this topic. We are also going to have today our guests, uh, special guest, I should say, coming from Argentina. We have Doctora Maria del Valle Bertone, Director of the Provincial Center for Physical Rehabilitations in Salta, Argentina. That's Salta province. And also licensee in occupational therapy, Marilena Martinez, the coordinator of the Posture and Mobility Unit of the Provincial Center for Physical Rehabilitations in Salta. CEPREFIS, it's called in Argentina. So many thanks, Maria Opala and Maria Elena, for accepting this invite to join this meeting. It's an honor for us to have you here in this webinar. So before starting, I would like to do a short introduction that we'll be doing all together. Jasmine and myself. There's a presentation prepared by Jasmine actually, and I would like to share some short words with you, just to say that this series of webinars that we are promoting about access to supporting technologies is attempt to disseminate and promote access to this type of technologies. And we do this not on an isolated basis as a Department for Access, but in cooperation with many helpers. Gianni Sonet from WHO, who is leading the team, actually a team led by Kylie, and also in PAHO, in an inter-program basis, our department works very closely with the Department of Chronic Diseases called NHH. The rehabilitation team led by Gustavo Perez Reina, who is always with us working on a coordinated manner in this interprogrammatic efforts and topics related um, with supporting technologies, all topics related to rehabilitation. So I would like to highlight that interprogrammatic works. Today, we have this webinar which is called Effective Access to Supporting Technology in the Americas. I would like to introduce some basic concepts. I know, and I must apologize first of all, because the experts that are here with us are much more knowledgeable of this. But we also have other persons who are interested in this topic and they're learning about new concepts. So that's why we will be starting with some basic concepts. And before going with Jasmine, and she will continue with the presentation. So, supporting technologies, concepts. There you can see the application of knowledge and the different organizational skills turning around supporting technology that define what we consider just that supporting technologies that include not only the products that we'll be talking about in this webinar, but also services and systems of health. So, supporting technology is something that is fundamental for persons that have functional difficulty, whether permanent or temporary, and that improves the functional capacity, improving their capacity of to be included in all areas of society. So, yes, next slide, please. We have in under this umbrella of supporting technology, the supporting products. The products are defined in a more objective way, merely saying any device, piece of equipment, or software used um, to increment, to enhance, maintain, and improve the capacities of persons that have functional difficulties and to keep the health of persons. So we need to make a comment here because many of you belong to regulatory authorities that exist across the region. And we know that many of these yeah, keep the slide. Many of these are considered medical devices. Others, not so much, are not classified as medical devices. So this is something that we are working on a priority basis because with the regulatory authorities of the region, there is a flaw in the classification of supporting products. In some countries, there is a percentage, more or less significant, of supporting products that are regulated by these authorities because they are classified in the first place as medical devices and they need to meet a series of requirements, I mean quality requirements that are demanded, yeah, for their corresponding registration as medical devices. But in other countries, that is a smaller group of countries do not follow this. So it's important that we should have, I think, a harmonization and more we can guarantee the quality of supporting products. Of course, products that are not part of this, that are classified as medical devices, that do not go through a rigorous regulatory process, they also need to have a good quality. So it is important to adopt international standards quality, and as always there are other normative organizations that regulate these international standards. Countries have different entities, institutes and technology institutes, and we need to work with those entities or institutes to give these persons quality that is, of course, the best. We need to need to work also on affordability. That is to say, to lower in many cases the prices of these devices, and we need to work on that. Next slide, please. So, among the benefits of this product, well, I have only to some of the benefits. Of course, increment or enhance the function and independence of persons, promote health, promote social, educative, labor inclusion. It's very important persons to be part of the educational system, reduce the workload of care of those that care of these persons, and increase productivity. I think all these are important elements and should be included among the benefits. And there are some examples of these products. You can see here some that we use every day that we don't think don't require certain classification. Uh, l- Lenses and frames for glasses. Um, we can see pieces of equipment that help the mobility of these persons, like walking frames, wheelchairs, and some technical aids to eat, to dress up. So these are different examples, and there is let's say a big range, a broad range of these products, technological, but all of them equally important for persons that need them every day. And here we are emphasizing on the need of this technical aids, and Kylie will be mentioning some of these, and we'll expand these topics, but we have some conclusions of the last report coming from WHO about supporting technologies published in 2023, known as GRADE, it's an acronym, and we have some statistics. Every three persons in the world needs at least of one supporting product. And that forecast that we have for 2050 indicates we'll be reaching 3,500 million persons that will require of this product. In our Americas, in this region, we estimate that around 220 million persons will require of supporting technology, supporting products. So that is something that we have estimated, and we know that in some places, in some countries, of course, depending because it varies a lot, depending of the Human Development Index, uh, we are going to have just 3% of access. I mean, 3% of the population that will have access. So we have in front of us an enormous challenge, an enormous depth, so to speak, of our population. We need to involve governments and health systems to increase the access. Jasmine will be speaking shortly about the barriers to access that persons need to overcome to have access to these products. We have among them, for instance, the high prices, the availability of these products in certain parts. Um, the let's say the health systems they oftentimes don't have these products that can give them to the patients. So we will be hearing about that shortly. So I'm going to stop now here. I'm going to leave you with Jasmine, who is going to continue this presentation. We have connected already 132 participants, and this number is increasing for this topic. I think we never had so many participants and so much interest, and that, of course, encourage us a lot to continue working and disseminating this type of information for you. Once more, I want to thank you for your assistance. I will be here around anyway. Um, we will be recording. I think we are recording this actually that is available for you in case you want to disseminate the same message among the ones you know. And we want to thank our guests and our speakers. Many thanks to all of you, and I'm going to leave you with Engineer Jasmine Garcia. Gracias. Thanks, Alexander. Can you see my screen? Yes, we can see that. I'm going to speak a little bit about barriers to access, or I should say, effective access to supporting technology. And here, what we want to promote with this webinar is that access to supporting technology, supporting products is not only, let's say, the donation, but rather appropriate provision after identifying the needs of the persons and satisfy the needs. So they can be solved through the appropriate product that, of course, once more, I must emphasize, satisfy the need of that person. So before going into the barriers, I would like to speak a little bit about the prerequisites. So a supporting product really is useful for that person. Not only is to give the product, to donate the product, to provide the product, but that product should be of the right quality, safe, efficient, and for the problem that product is intended to solve. This well as suitable to the medical condition, the size, the architectonic environment, social environment, that person. And for that to be accomplished, they should be delivered through effective services, service of high quality and of course, above all, accessible to all of them who need it. And what are the services that we require to provide this supporting product in an effective way? Well, first of all, we need to identify what is the need of that person, of that patient, so to speak. And for that, we need to carry out an assessment. And after that, the selection of the right product. Adjust the product to the needs, to the size, the configuration of the person. We need to teach the users and those that take care of him how to use that product right, how to give it right maintenance, and what to do if the product, let's say, breaks down. It's important to, let's say, necessary to have a follow-up, a monitor of the product and contact on a frequent basis that person, just to make sure that the product continues to be effective, is the right one for his need. And if not, we need to retake that assessment cycle as I mentioned before. It's also necessary that maintenance and repair services are available in that place where the person lives. That is, if it breaks down, it requires a special maintenance, those services need to exist in the vicinity, so to speak, where that person is living, so that person can continue using the product and it's not thrown away. And to achieve that, we need that the staff that is delivering the products, giving the products, be properly trained in the use of the supporting product. Now, after talking the prerequisites, I would like to speak now about access barriers. One of the main access barriers is oftentimes persons, both users as providers, health professionals even, do not know about supporting technology. They don't know about the need, they don't know the broad range of products that is normally available, and they don't know about the benefits, therefore. Even the users do not know about them and how the product can help them. So that can be summarized as a lack of knowledge, of the existence and benefits of these products. That is my considers one of the main access barriers. High costs. Some products are not easy to buy or to afford. In many places, persons, users need to pay from their own pocket, from their own money, the products. And it is here where governments, organizations play a fundamental role in the funding or investment of this product so that the persons can have the right access. There's also a limited availability of services. In other words, the services do not exist, or professionals, health professionals, especially those who train for rehabilitation, are not available or do not exist so that they can provide the support to this product if delivered to the patient. In many places, there are no availability at all. So, and if they exist, the quality is not good. There is a broad range of products, and maybe they don't know which is the one right one that can satisfy the needs of the patient. The characteristics, design of the products are not the right ones. Oftentimes, they are not available. If available, they are not of the right design. They are not effective, therefore, and they are not given through a service that subsidizes that. There is also a challenge in the supply and acquisitions of these products. Mm, the acquisitions or procurement process do not exist, or if exist, they are not the right ones to acquire the products and disseminate or distribute them to parents with the right technical specifications, meeting quality standards, and the entire supply chain, let's say, need to confront different barriers and making them difficult to take these products to the patient. As I said before, many professionals are not trained how, what steps should they follow to give this product to the person, to the patient. Many governments doesn't have even an interest in promoting or investing or funding the access to supporting technology or to develop the supporting technology. Um, because this, of course, entails some expenditure and also to put in place the right services. In many countries across our region, there are not much norms or standards. The standards about quality and performance of the products, there are no regulations to govern the professionals, let's say dictating who can provide prescription lenses, a wheelchair. In many countries, this regulation does not exist. Also, regulations about the right training of professionals. It is not specified in what field or what courses they should take to become a good professional to, let's say, repair, maintain, to provide this products. And I said before, the lack of funding and investment, the lack of finance, and the fragmentation of the sector. There are products that are given on isolated basis in certain sectors or in a small institution of the health system. They don't consider the entire health system. And that is not only for the health sector, but the educational sector as well that should be involved so as to improve the coverage and of course diminish the cost of this product through the unification and standardization. In many occasions, we have social and demographic barriers. Women, for instance, need to overcome more barrier than men to access these services, the elderly ones as well. So there are many barriers that hinder the possibility of these persons to access the right product to satisfy the need. And with this, I would like to leave you with Kylie. Thank you, Kylie. Yes, the floor is yours.
Um, thank you very much, Yasmin, and also to Alejandra for fantastic framing. And also congratulations to Yasmin for gathering such a great group around this initiative. It's wonderful to see how many people are online. I will just share my screen. And what I would like to do is pick up right where Yasmin left off with this large, sometimes feels rather overwhelming summary of the barriers that we have to face in order to ensure equitable access to assistive technology. And so, what I would like to do is offer you a framework of where to start and how to think about improving access. So, this is a framework that we have developed and are using at WHO to guide the work that we do in supporting countries, the documents, the tools, the resources that we prepare to support countries, and then also to help countries to frame a strategic approach and strategy to be able to improve access, to be able to understand where things are at within a country and where action needs to happen, and to put that into a way that you can think about it comprehensively and all the different elements. So the framework it's called the WHO GATE 5P framework. I don't know how well that will translate into Spanish, but in English, we have a P word for each element of the framework. The word GATE there is about the Global Cooperation on Assistive Technology, which is an initiative that WHO hosts, which is really just a group of people who are passionate about access to assistive technology. So we have around 3,000 members globally who contribute to this work. So the WHO Gate 5P framework is essentially a comprehensive strategy for access, which helps us to think about the 5 areas that we need to consider in order to address all of those barriers that Yasmin just described. And it's actually a little bit similar to what Alejandro introduced in the introduction around services, systems, and products. So it's quite similar. I'm going to just go through each P and give you a little bit of an idea of what we think needs to be addressed under those and a few examples of action that can happen at the country level. So, from the first one, the people P. So, this is about putting people at the center of all of the work that we do. But it isn't just saying we need to make sure that our services are appropriate for people. It's about making sure that the families of those that use assistive technology, their support networks, and communities are fully aware, are well informed, and are empowered about how they can access assistive technology, and that they can be also meaningfully engaged in shaping all aspects of assistive technology systems. So we want the services to be appropriate, we want the products to be appropriate to people. We also really need to act on ensuring that the people that use assistive technology are part of the development of the solutions. So it's a kind of two-pronged area with the 2 Ps. So, for example, in terms of action around this area, we think about considering if you're doing work at the country level to ensure that a steering committee that is working on strengthening assistive technology has people represented. So people who use assistive technology represented on that committee. It's about having policy in place that ensure that services are recognizing the choices that individuals want to make about their assistive product, or it might be about putting the voice of assistive technology users into the procurement loop so that we hear from assistive technology users how effective the products are that are being provided to a given population. So, people is a really important area of work. Then we think about the policy. And so, for this area of work, what we really want to do is establish cross sectoral assistive technology policies. So we know that action on assistive technology can't just occur within health or within education or within trade or within the finance system. You know, we need to involve all of the sectors in order to have a full solution for a given population. So we need cross-sectoral assistive technology policies and finance mechanisms that are driven by data, driven by evidence, and that promote equitable access for all user groups. So we do often see in a country that the starting place for improving access to assistive technology might focus on a particular group of people. Maybe it's very focused on disability, but it doesn't include the needs of older people, for example. So we want the policies to be cross-sectoral, and we also want them to think about all of the people that are going to benefit. We think about the 1 in 3 people who need assisted products. It's a large group of the population. And of course, the policies need to think about and have attention to gender, age, and cultural sensitivity. And I think the other point about policy is that it's not just national policy, it's all the way down to the policies that occur within an individual institution or a hospital or a rehab service or a school, you know, whether or not assistive technology is integrated into those system level policies. So, again, for example, the action can be thinking about how a country gathers data to make sure that they've got good evidence to inform policy. And for that, I know you can reach out to Yasmin to learn more about the WHO AT data toolkit and how that can really help to gather data to inform policy within a country. So the third P is about the products. So obviously we need access to, we need consistent access and we need availability of the most important. We need to prioritize and think about what are the most appropriate, most important products that are needed within a population. And then we need to make sure that those products have the available spare parts and the accessories, that they are affordable, that they're adaptable, and that they are relevant to the context in which people live. And that is a really big global challenge. We know that in many low-income countries, it's really hard to find products that suit the environment that people live in. A lot of products are developed for high-income urban settings, and so we need to drive innovation around ensuring that the products are appropriate. And we also need within this product P to think about the procurement mechanisms and the supply chain. And then, as Alejandro talked about, we need to think about the standards and the specifications and make sure that products are safe, can be repaired, and can be sustained. And then we need to think about the end of life of that product. So, how is it going to be sustainably taken out of service after it is no longer useful and doesn't become something in a big pile of junk somewhere? And so these areas around product are really important to think about and multidimensional. One of the things that WHO is doing is the development of a global priority list of products, and many countries are using that to start their own national prioritizing and to develop their own national priority lists. So that is an important tool that is helping many countries to know where to start. And in terms of the provision P, which is really talking about the systems that Yasmin was talking, really described, we need to make sure that the products are appropriately matched to the individual. And so that requires a provision system. And so, what we want to do within the provision P is to make sure that assistive technology provision is embedded within relevant sectors such as health and education and aged care and social welfare. And we want to see well integrated referral pathways from community level, where some needs can be met, through to secondary, through to tertiary level, where more specialist needs, such as, for example, prosthetics and orthotics, can be met. And again, some examples. Actually, I do have I think I hid that. Yes. Um, One of the things I just wanted to really quickly speak about is to pick up on what Yasmin said around services, is another little framework within our big framework is this 4 steps for service delivery. So we need our provision system, but then when it comes to the actual access part where a person is assessed and provided with a product, we can think about 4 simple steps, which is to select. So you assess the person's need, you select the right product, and then it's about fitting it, so preparing and adjusting that product for the person. It's about using it and teaching the person how to use and maintain it, and then follow up, as Yasmin mentioned. And that step happens within a whole pathway of people being able to know that they need assisted products, going on a journey and looking for the services where they can have their needs met, and then realizing their rights through access to assistive technology. And then the final P that I wanted to raise with you, of course, is personnel, because without the staff, we cannot run any of that. We need staff to be able to manage the procurement processes. We need staff to be able to identify and refer, and we need people to be providing those 4 steps, people that are repairing products and so on. And often within the personal P, what we see is a focus on action on those that are doing the service delivery. And I guess I would like to really emphasize that the personnel P is broader than that, and to think holistically about all of the staff that are needed to be able to manage services, ensure they're financed, to monitor them, to be able to do the screening and the referral and so on, and the procurement. So it's quite a lot. And within the personnel P, we want to be making sure that staff are well incentivized, that they have the appropriate competencies, and so on. So some examples of that are, for example, making sure that assistive technology is integrated into the relevant curricula of the different staff that would have a role in assistive technology. That has been a really fast introduction to the 5P framework. I went through it quickly because I really wanted to make sure that we catch up some of our time and give the time to the team in Argentina who are going to put this into an example of what they've done to be able to make assistive technology, more accessible within Argentina, and going through a model that really does use this service delivery process. And so with that, I would like to stop speaking so that I give the floor to our colleagues in Argentina, and would just like to say if anyone has any questions about the 5P framework or those small examples I gave around how WHO can assist, have the most amazing team in PAHO who can answer many of those questions and channel anything through to me if need be. Thank you so much.
Mu- Maybe I was just explaining a mistake we did and took a picture of the speakers in the very beginning. So pr- just stop sharing for a few seconds, and I'm going to ask you to open your cameras so we can have this official picture. Maria, yes, the two of them are in just one frame. Um, I don't know if, yeah, you know how to do this better than I do. So, please, yeah, don't worry, I'm organizing here. Yeah, we have over 152 participants, quite an impressive number. Many thanks to all of you. I know that this, for some of you, meant taking some of your time to be here with us. Okay, so many thanks, Lisette. Was more apologies. I should have been doing this in the very beginning. So, Maria, the floor is yours. And many thanks for participating. I think this is quite important. It's always good to have an example of a country, a real example of how all this works. Well, first of all, many thanks for the invite. For us, it's an honor to be here and a pleasure to show you the work we have been doing in our rehabilitation center. This presentation is going to be divided in two parts. The first one, I will be showing everything we did to reach a place where we are right now, or the position where we are right now. And Maria is going to speak about the services that we provide. So, where Salta is, it's a province in the north of Argentina. It's a province that has let's say, large province rather, and it's difficult for many persons to travel long distances to reach certain centers. It's one barrier, the geography, the distances. As for the population and demographic information, especially those that have a deficiency, we in the northeast of the country, we have about 10% of the population. What that mean, that 10%? Well, that means 140,000 persons that require of assistance in rehabilitation. So, um, as a provincial center for rehabilitation, and we belong, by the way, to the Public Health Ministry and to the Disability Secretary, and we have among our objectives to um first of all, to put in play the strategies and action plans and easy the affordability and access. That's really a problem here for persons that need of this assistive technology support. And all this started in 2013. In 2018, 5 years later, we started to create to define the services, define the model that is a comprehensive model for rehabilitation, as well as we start to define the equipment and pieces, material that the center is going to require. Actually, to have the staff that is properly qualified. They have a comprehensive view of rehabilitation, so they all speak the same language. They all are kind of the same page and generate a change in the person that is using this product. In 2018, this was kind of milestone because the children rehabilitation area was open, 14 years and older. Uh, this multidisciplinary team and second level, as we call it here, kinesiologists and occupational therapists, and we'll be talking or showing all the areas. And we said, yes, we need to include the children's rehabilitation area. And all this was a province, a process. In Salta, the province, rehabilitation was not part of the health system. Back in 2020, that is 5 years ago, we all suffer. We remember the consequences of the pandemics. We started to think about the times and to train ourselves, and we went straight into the international classification. Our treatment, our plans, and the planning of the treatments are based on international classification of functionality. We do an initial assessment. We meet on a weekly basis with a team to examine each case and to address the situation of the person. We train ourselves in rehabilitation with a focus on community because that is a way of reaching those that need our help. If and have the right strategy, so we can reach all corners in our province. So, how we assemble, put all this in place? Um, yes, we need to work on a comprehensive basis and jointly with all the persons. We work with and the National Agency for Disabilities. We also start to work with social communities, council, yeah, that belongs to the Social Development Ministry. Um, and that was embedded in the public administration of Salta, and also with other NGOs, we established certain partnerships too. And there, a first project was all included, todos incluidos was put in place. That was the first big project that we have institutionally. Um, and interinstitutionally as well. We continue to train ourselves and with wheelchairs, for instance, through ATA. And what is important here is that all the teams started to train at unison. Even the addressing of international classification for functionalities, they start to work on that, but from the administrative point of view, because we all need to have kind of same language.
Another important milestone is that we had the mobility center and the rehabilitation center and the prosthetics area, considering that all support items should be included in this integral vision for the people. In 2022, the institution was certified through the ISWP. In 2023 and 2024, we always had to strengthen, and we were constantly acting. All of the professionals in the rehab center were training in different areas. Many areas related to strategic planning, because we consider that if there are no objectives or proper planning, we wouldn't know where we're heading towards. And today, the rehab center in the province for adults, it's conformed by all of these different units. And these units, when are transversally crossed by social work, nutrition work, nursery, the mobility and posture unit, rehabilitation for the pelvic floor, prosthetics or orthesis, and smaller units that complement all the work. But everything is done transversely. All of the work is done transversely. And children rehabilitation, which is an area that has to continue growing, has the same vision, it has the same outlook. And the posture mobility unit is included in every area. It includes social work, and there's no way to be able to understand or to offer a proper support technology if it's not assessed by all the areas, especially with social work, by the social work area. In 2020, we started to work with something that's called the Rehabilitation Provision Plan, and we think that this work has to be done integrally, has to be done in every area, not only in health, but we have to articulate with every single sector and the different secretariats in order to reach every person. In 2020, we started to think about the rehabilitation provision plan with three different axles: the rehabilitation plan for the community, another one for assistance technologies, and integral work for rehabilitation. In regards to this, and now talking a little bit about what what's bringing us together today is assistive technology, and we created a problem tree. And we see a low accessibility and availability of this type of assistive technologies. And we assessed in this last years that, and we have to highlight that every time that they invited us to some place, what we did is to focus on the proper service of provision. It's not only to deliver chairs or to receive donations and just to disseminate them. And due to externalities, finding the seats shouldn't be done just for the sake to give a seat, a chair. So there was a lack of knowledge in the team. And this is complex because in theory, we should be better trained. And there's also centralization of knowledge. There are very few people who really manage and are interested for these type of provisions and types of products. Another one of the issues is the lack of vision for by the financiers. It's considered an expense, not an investment, and this is very complex for us because this is something that we've had to defend. And I'm referring to the product that we're looking for and the product that we're choosing for a determined type of person because of the high cost. So they see this as a cost or expense, not as an investment. They don't see this as a preventive action that's going to and everything that it means to have a proper product. We don't use a circular system. The financiers buy and throw away, buy and throw away. Many times it's a mistake to understand what a assistive technology is used for. What we have to do is to choose the proper product for that person. And we don't use circular systems, and that's why there's an anti-environmental problem here. The high cost is always present, and within this we have weaknesses in the system. And this is like the intersectoral dearticulation. It's like the assistive technologies and everything that's related to assistive technologies, like wheelchairs, prosthetics, orthoses, and they don't see this as a need that has to be within the schools or the ministries of social development and the Ministry of Finance. There has to be an integral vision in order to generate the proper systems to offer a proper system. So our conclusion is that there's a lack of training. There's a partialized training, and this is information that's concentrating in very few spaces. And the only thing that they see is cost, not investments. So the result of all this is inequality to access, less autonomy in the quality of life, and higher cost in health and rehabilitation. And this ends up in social exclusion. So what we started to think about, we decided that we had to look for a way to articulate, we have to find a way for people to have a service, a proper service for the chairs. So we have to start to go out and try to take advantage of the opportunities. We're talking about technical assistance and wheelchairs. There's an important institutional change that has to do with the strategic plan, where we have a plan in place, looking for the objectives that we are aiming towards. And based on those objectives, we can start to create a development plan. We work with the foundation with foundations and NGOs that are going to help us to generate and to look for financing and also other activities. And other alliances and stakeholders are starting to add up to this, like Andes, the Secretary of Social Community Strengthening, the Subsecretary, the Undersecretary of Medicine, Social Medicine. They have been fundamental in this work. The Ministry of Education and hospitals and faraway places from the capital. We continue with the trainings. We'll continue by introducing ourselves in different events and working in different events that are related to training and assistive technologies. And in relation to the Fundación Amigos del Centro de Rehabilitación, this allows us to do agreements and allows us to create alliances to generate tools and also strategies to continue advancing this work. In 2025, we do a community-based rehabilitation. And this was very useful because it showed us the different barriers that were in place, what we had to do and what we didn't have to do once again. One of the things that we're able to realize is that cannot generate a demand and then not complying. And if we cannot organize properly, we won't be able to continue this work. So the Undersecretary of Social Medicine and the Ministry of Health were able to begin with a rehabilitation process based on the community. This is a logical framework for this project. And we focus on the efficiency and the access and the implementation of rehabilitation based on the community. And I'm going to show you where Santa Victoria is located. It's 7 hours away from the capital. And our biggest constraints were geographical access, language barriers, because these are different communities, social, economical vulnerability, and the lack of knowledge of what community-based rehabilitation does and how it can generate good actions and good strategies. This is Salta Capital, and the blue dot is Santa Victoria. That's where we have original countries like Huichiche, Orotes, and Tobas, and there's approximately 13,000 individuals that live in that community. And we consider that there are approximately 1,300 people that require assistance. These are some pictures so you can see where we are located and how the socio-economical situation looks like, and the geographical situation too. We started to work in this project in articulate fashion with different institutions, especially institutions that belong to the ministry, to the Salta government. And we have to get to that place. We have to look for a way to get to that place. So what did we do? We created a plan. We started to travel every 15 days. The professionals, 4 professionals per travel, where we have different types of specialists. Once we arrived there, we did an assessment. We met twice a week in Salta in order to plan out the interventions that were going to take place. And then we did a follow-up process for the different interventions that were done in that population. We also worked in training the sanitary agents that we have to congratulate them because they are a fundamental element if we want to work in community-based rehabilitation in faraway places. And this is our follow-up scorecard. And this is Santa Victoria Este, trying to show some humor. These are the CEPREFIS professionals. This is the biggest asset that we have in terms of human capital. There's no doubt about that. And we're going to start to see interventions that we're doing in the community. We do the initial assessment. We see what the people need. In this case, in Tauriza, this are prosthetics and orthosis and technical aids for walking. And many times we try to recycle and adapt, and we adapt based on the needs that the person has that we're trying to assess and help. We also gave this child a walker. It was adapted. We looked for a way to adapt it so that this child could walk. And she uses it every time that we go to the community. They're waiting for us. This is another case. This is another child that needed an intervention. And many times we use material that we have, but we try to adapt it. We do not use material we try to adapt the material, and we start to work based on that. In this case, this is the same patient that we saw before, where we adapted the orthosis, and at the same time, we adapted a wheelchair that we had that was donated to us, but we adapted it and we um, customized it for her. Our objective is for this to be a solution until a solution while we find a final solution. This is the primary assessment. After doing the assessment, we work on adaptations. Many times we don't have the equipment that we need, but I'm not going to wait for that in order to create or to start applying actions on the person. So we have worked with the WHO and the PAHO to do this type of implementations. We know it's not the perfect wheelchair, but we'll continue to implement them if we can. This is the same thing, trying to teach and to do assessments. Some statistics here before closing. This is the project. The project will continue if we can intervene 62 patients. These patients are still in the follow-up process. We continue having um, overseeing these patients based on the needs. Via the Ministry of Health and the interaction of different entities, we started to show that this is fundamental. It's very important to showcase this work, to show the importance of doing this type of work and the follow-up processes after it. This is the Santa Victoria Este Hospital with all of the different specialists, and is the group of people that go and visit these places every 15 days. So this is the timeline. Before giving the word to Madalena, we wanted to show something that started yesterday. This is the first course for maintenance of wheelchairs for people that live in the municipalities. It's important to have places to fix and to maintain these wheelchairs. So we created a course with the help of the different institutions. And this was yesterday. We're working in education with the Ministry of Social Action, the Secretary of Community Strengthening. There are NGOs, foundations, and the Secretary of Disability, where we work at, and us. This is the first meeting. There are going to be 3 meetings, one per month, where we give different strategies so that the agents in the municipalities can acquire certain abilities to be able to fix and maintain the wheelchairs. So I wanted to show you everything that we have been doing in these rehabilitation centers. Now I'm going to give the floor to Mari. I'm going to share her PowerPoint so we can continue seeing the different actions. Thank you. Good morning to everyone. Now we are going to focus on this services within the physical rehabilitation center. This is the team. And that's the secret of what everything that we have been doing so far and the results that we've been able to yield to share with you today. I wanted to tell you how this was how the training process looks like. I think we're seeing the last presentation. I don't know if you're sharing the new presentation. I think you shared the previous presentation. This presentation has great pictures that I would like everyone to see, that all attendees to see it on the before and after and how you are doing your work. Thank you very much. Okay, you also already heard the opening. Now you can see the whole team here, and everyone tries to help from their own experience, their expertise, and we've been able to achieve important results, and we want to continue growing. So these are some pictures of our training or internal training process. We gave a specific training. You might see some faces that are familiar to you. We have people like Silvana Conteponi, Sofia Bello, who accompanied us from the beginning. And these are some pictures of the internal workshops where we started to create the pillows. We did research. Like Dr. Bertona said, in 2022 is when this unit was formalized in the physical rehabilitation center in the province. And within this province, there are three structures: the service for provision for elements and posture and mobility. And within this, we have the service for wheelchairs, bank for elements for posture and mobility that comes from donations, but from a circular standpoint. And there are many elements that are assessed and fixed to be assigned to once again, and also an issue related to maintenance. Within this wheelchair program, we consider that stance is very important. So in every interview, there can be adjustments and suggestions. We can give graphic material with simple drawings, as you can see here, focusing on the stances with low-cost elements while we find final solutions. And we have to take care of the stance, knowing that the starting point for functionality is this, having a good stance. And we started from stance, we started to assess mobility. We're starting with assessment to know if they have a wheelchair or not, if it works or not, if they have one, and if they don't have one, and we can have an element that after the proper assessment and adjustments can be useful on the meantime. But all of the users have to go throughout this whole process for obtaining a wheelchair. We have to follow guidelines from the WHO. Regarding the wheelchair provision, as we said before, all users have to go through the 4 different stages which would be the selection process, adjustment, training, and follow-up. So diving into each one of the stages, first we have the assessment, and that moment is where we can define the technical specifications of the element that's required based on measurements, assessment, kinetics, and different aspects. All of the different actors are part of this process. And regarding the intermediate stages that was mentioned by Dr. Bertoni, to the left, we can see a user that arrives to the rehabilitation center. And based on what we have, we try to give a solution that's not permanent. There we can see the stance, the position, and what potential we have in our user for thinking about the proper element that will be thought out for this person so that they can be more functional and by taking care of their stance. And then in the adjustment stage, we all start to get involved here, and this is done constantly. We have to assess our rehabilitation processes here. The third stage, which is training, we can see some pictures, not only of the training process for the users, for maintaining and fixing the wheelchairs, but also the family members, where we explain to them how each component works and to take care of the shelf life of this element and what to pay attention to when wanting to change the wheelchair to do or to fix it or to do an adjustment. And the fourth stage, which is follow-up, we have a scorecard for follow-up for being able to have systematic controls. But in many times, this is one of the stages that become the most complicated because of the accessibility constraints that we have. Because once we get the product, and after doing the necessary adjustments, and after it looks nice, after the person is using it, there are some users that get lost in the follow-up process, but we're not going to stop working or analyzing some ways to complement this stage, which is fundamental to decide if we will continue using the same wheelchair, if there's some necessary change or adjustment to be done. In terms of recommendations of the WHO related to the systems, we focus mostly on having competent personnel, thinking that we want to have the proper competences during these training sessions for the people who receive the patient or the user that can inform what are the requirements. So we have a day for evaluating this. We tell them what they have to bring with them, and they accompany us throughout the whole process, especially the administrative stage for paperwork, for presentations, and documentation. Other strategies that we use for being able to achieve this has to do with having a bank of elements for extensive mobility and also agreements and alliances with ministries, hospitals, and companies. In terms of the bank for the different elements, there's a registration. Once we receive a donation, we create a list and we do an assessment of the condition of the element that was donated. We have a technical scorecard where we describe the element, the measurements, the traits and characteristics. And there's also a moment where we fix the elements that's going to become available, but not for anyone. At the moment that the user arrives, we do an assessment of the user. And that's when we can see this process where we carry out the assessment. We assess if we have an element that, if we have the corresponding adjustments, can be adapted to the person. But this is not for everyone. After this, we have to sign a document or an agreement with the person that's going to take this element. Then we can do the follow-up, and there's another stage for reassessment, depending on the characteristics and the equipment that was provided for renewal or for return. The return is in case that the element that was created and thought out for this user. In regards to agreements and alliances, we have the Ministry of Education, of Economy, Public Health, the one that we work in. Penitentiary Service, the National Agency of Disability, National Programs, the Secretary of Disability, and also another one that's in charge of fixing the wheelchairs that started yesterday. They added themselves yesterday. In terms of companies, we don't have any conflicts of interest because these are donations that are given to the rehabilitation center. And many times these links become facilitators in order to help us to have success in our work and to be able to obtain the necessary products. And these products are assessed by the whole team, as we said before. Now I would like to share some pictures so that you can have a clear idea of what we do. In this slide, we can see two users that have their own wheelchairs. They're not the most expensive ones. They're just the ones that they're able to obtain. But we try to do assessments and adjustments based on what we have in order to have the best symmetry and to improve the functionality. In this case, we have a user that arrived in the little cart that's in the left, and based on her age and weight and her height and functionality, we were able to supply a wheelchair with the correct positioning to improve her functionality and the possibility to be able to go to school or to visit their family members and to go out. We have been covering the faces of our users, but in this one, we thought it was important to show the process. We chose the proper wheelchair for this child, and this is how she looked like when she arrived into the rehab center. And to the right is when we received the wheelchair that we have requested. They made the necessary adjustments, and you can see how her face changes and her stance changes, the position of her hip and everything. Now she's ready to go out. The same thing applies for this one. To the left, we can see how she arrived with this wheelchair that she received as a donation. And to the right, we can see how everything changes, her face, her alignment. And this was due to the assessment and adjustments. And after explaining to the mother why all of this is so important, we had to explain why we put the seat belt and everything else. This is to give more stability to the patient and to help the person to be more functional. In this picture, we have another case of a donation, where to the left, this is a picture that was shared where we showed the donation when it arrived. And to the right, we can see the picture of the same wheelchair after the adjustments made from the material that we had available. And this is fundamental in order to have a correct stance and become more functional. This is the same thing. To the left, we can see how we met this user. And we started to do adjustments. We used foam for the chair. We improved the position and the stance. And to the right, we can see a new picture that was published in the social networks. And many times we have to insist a lot on why we need every part of the wheelchair to avoid having what we see in the left, which is a wheelchair that's not the proper for the best one for the user. Now more pictures of visits that we made in this work with the Secretary of Development, Silvana, and the team was there. We were able to go and do some adjustments and trainings. We were able to speak with family members. In this case, We talked with we did this work in the indigenous populations. These are the users that we're able to assess and to improve their stance and to do some adjustments. Also, in this case, to the left, we can see how the process started to assess from a medical and standpoint, occupational therapy, positioning, and the right, we can see a before and after, where you can see the alignment, the symmetry, and the possibility to be able to have a better and more functional life. In terms of training in 2021, also in this project called Todos Incluidos, we gave training to sanitation personnel and to teachers. In 2023, we continued. We opened up a little bit because a lot of teachers were inquiring, and also the parents were inquiring about this program, and we're able to talk about stance care, and we gave recommendations from the WHO when we were going to give out the wheelchairs. In 2024, we began with a training module for health professionals with a great response. We had an average of 30 to 40 attendees. And they continue in this training process. We began with community-based rehabilitation concepts. And then we taught guidelines from the WHO, a second module, 12 hours long, with theory and hands-on work when we started to evaluate the stances, and we showed what are the right and wrong wheelchairs to give to the patients based on fundamental concepts. We were able to do tests. We showed the available products. And we know that if there's something better out there, we have to look for it and try to bring it. In 2025, we had the third module with 12 hours each module. We went over generalities and we continued focusing on the recommendations from the WHO. We dove a little bit more into the universe of the chassis and the wheelchair systems. In November, we are going to have another module with theory and hands-on work, focus on stands, and we're going to dive more in the chairs and accessories. In the rehab center, we have a team that knows that the proper wheelchair is going to be a tool. And we talk about proper wheelchairs when it respects these four instances: assessment, provision, adjustments, training, and follow-up, having periodical controls in place. So we work so that each one of the users can have these chairs. Silvana Conteponi said that wheelchairs are not given. You have access to a wheelchair through a provision service. It's fundamental to have an assessment, to do adjustments, to do follow-up, and also training. So that's what we do. Thank you very much. Thank you very much, Maria and Maria Elena, for this excellent presentation. I'm very happy to see all of those pictures of the before and after, where we can see the type of product that these people have access to, many times through donations, and also the wheelchairs that are available and that are given to them by family members. But I'm really happy to see that through this work, you have been able to modify, and sometimes by even using the same wheelchair, that in the beginning is not the right one, but you have you adapted in order to have a better stance for the person. So I'm really happy that you're sharing this experience with us, and hopefully the attendees in this webinar can take back home this idea that sometimes we don't have access to the right products, and when we have access to the right products, this can be done via financing and the acquisition of these products. But when we cannot do that, it's important to show how these types of services can help people to have more comfort and to be more healthy, to have a better balance, and to be more functional to perform their daily activities with what they have. And thanks to the knowledge and the abilities that you've developed and you have shared with the members of your institution, you have been able to achieve this. I would like to thank you for this wonderful presentation. And we're about to finish the webinar, but we have a few questions. A question comes from Cecilia Garcia, and she's asking, what are the measurements that you would consider that the stakeholders like designers, engineers, health professionals, including the professionals in mental health, we should take so that what this distributed services was easier to implement? What are the measurements that you consider that all stakeholders should take in order for the distributed services would be easier to implement? I think the main measure is to give the proper training, to know the norms, and to have a patient-centered approach with a multidisciplinary team. Based on the international classification of functionality, the core sets might be a little bit complicated for us to use because of the methodology and because of the way that we work. The concept of the context of the person, the context of generating this assessment of the different areas, I think it's one of the most important points to take into account, and especially the fact of training, of not being afraid. And many times it's about trial and error. And also to generate knowledge and to raise the awareness of the different stakeholders, especially the ones in the government, to show the importance and try to see this as a preventive action. If I use the right wheelchair, I will avoid surgeries and alterations of the quality of life and unnecessary supplies. And also, I would avoid to have additional expenses in the health sector in the future. Internal organization helped us a lot in order to go outside and do our work. We have to do the assessment. So we have to respect all these steps internally, and we have to demonstrate why we have to respect all these steps so that this can become something contagious, so that we can become passionate and to be able to reach or to obtain the right product for every person. But firstly, we have to work internally and then show why it's important to organize ourselves internally. We have another question from between. She's asking, how do you use the warranties in order to have a circularity in the technology? So they're talking about estimating the shelf life. Sometimes we get products that we would include in the slideshow where there are no conflicts of interest, but there are some companies. We try to go to the suppliers or representatives, and the customization of this wheelchair, for example, in this last workshop we did, we have to put apart, to take apart the wheelchair, and we have to talk to the OEM to see if we are able to fix it again. We have to disassemble it and then assemble it once again. That's why it's important to have these alliances with suppliers and representatives in order to guarantee the feasibility of the product. Sometimes we have to throw some products away, and we have some leftover parts that can be used for another wheelchair. We have another question, and the rest of the questions can be answered via email because we only have 5 minutes left. What does the assessment, social work focuses on, and what's the objective of having this assessment or evaluation? Social work for us is fundamental. But this helps us a lot by gathering information about the situation of the patient, their family ties, their resources, their financial situation, social situation, family situation, emotional situation. And this is what's going to help us to give us solutions. So we have these traits on this patient, the user has these characteristics, and this helps us to articulate with a secretary, with another institution that helps us. So let's say that they don't have this or that, we can try to have a better guidance and to orient us. Another question that I think will be interesting is what's the time frame from the evaluation to the delivery of the wheelchair, and how long does the people keep the chair, and if they return the chairs once they don't need them anymore. So what's the time frame of the cycle from start to the end? When we did the assessment until we found the wheelchair, right now we're trying to reduce the time frames because the delivery of product does not depend on us. We do the assessment, and it's not up to us to give the product directly to the patient. What we try to do is to reduce the time frame, and sometimes we do the assessment, and if everything's okay, we might find a wheelchair right away and do the adjustments the same day that we do the assessment. If we have the elements in the bank and the element bank, we might be able to find a solution really fast. And in terms of the return of the wheelchair, that's another one of the things that we have to work very hard in order to improve. Sometimes we establish, based on the characteristics or the distance where the person lives at, we can say a renewal will take place in 1 month. If they live in the city, probably in 2 months or 3 months, if we consider that something that's transient. Sometimes we would like to do the controls so they don't come by themselves to do the returns or the renewals of the wheelchairs. And we have cases where we do have success, and we have users that are super serious, and if they come every 15 days to renew their wheelchairs, and we renew this for 15 days or 1 month or 2 months, it depends. And in this case, it also depends on the user, where he lives, the possibilities that they have to go to the center. Many times we can even have the renewal through a phone call. But if there's something that gets damaged, they'll go to the center to do adjustments, tweaks, or changes in case it's necessary. I would like to add that the administrative area plays an important role, which is to call the patients and contact the patients. When we need to go and pick up a wheelchair to bring in, Jorge helps us. We have a social assistant, and also the maintenance area can help us to get those wheelchairs back. But this work has to be done constantly. We need to go through a process, and you have to follow the necessary processes to avoid losing things out of sight. I would like to thank you once again and to share with you. We have a course that's in Spanish and English. If you go to the virtual campus webpage, we have an introduction to assistive technologies, where you will be able to learn about the different tools that are available in the WHO for improving access to assistive technologies. Go to the webpage. The course is available in English and Spanish. And we're running out of time, but basically this is what we do. We help the governments in different countries to assess their capacity to acquire, regulate, and provide assistive technologies to identify, or help the governments to identify what are the needs in the population, to create action plans to improve the access, go through the policies, norm documents, help them to develop the priority assistive technologies list, the acquisition of products and technical specifications in assistive technologies, and also the development of the professional capabilities. That's my email, Garcia Yas at Paco .org, and these are the different tools that are available for assessment, for policies, for provision, services, products, personal and assistive technologies. And this is the web page of the course. So I would like to invite you to take this course. It's in English and Spanish. And having said this, we can finish our session for today. Thank you very much to everyone for staying until the end of the presentation of the webinar. And once again, thank you very much on behalf of my team and Kelly and Alexandre. Thank you to Maria Elena for your presentation and for sharing all this insight with us. And I'm pretty sure that this will inspire many of the people who attended. Thank you very much. And thank you, and to the attendees. So I'm going to share in the chat the pages of the course in English so that you can click on it. That's the course in English. And this is the course in English for the people who speak English. It's self-learning for anyone who wants to take it.